Hello and greetings from Team Mrcpi Tutors. It's Rolly Mentor this side. With me is my wonderful team, Dr. Chin and Dr. Tehmina. Hello, team. How are you doing? Hi, Chin. Hi, Tehmina.
Hello, how are you?
Thank you so much. Thank you. Hi, Chin.
Hello. Good morning. Good morning,
Thank you
everyone.
so much. Thank you, my dearest. We are back again with our famous Know Your Exam series, friends, and we are here to guide you and enlighten you on what exactly Mrcpi Osce is all about. Thank you very much to all the students who have joined in, and thank you very much for all those who are in the study group and who are eager to learn about Mrcpi Osce. Over to Chin, he would guide you regarding what exactly this examination contains, what exactly it's all about. Warm welcome from the Team Mrcpi Tutors. We are going to start the Osce details just now. Over to Chin.
Yes, thank you, Dr. Sidrali, for the kind introduction. So the outline for today is about the Mrcpi clinical exam. So what is this exam all about, which is the Part 2 Osce or clinical? So we will talk through to you about the exam format, the structure, and why are we choosing Mrcpi, and what are the opportunity, what are the doors that will be open when you have a full Mrcpi membership, and how are we going to prepare for it? Of course, the study group, which you all have been active over the last few days, we will be solving recall with Dr. Tamina, who is an expert in giving all the tips and the tricks and all the guidance, and of course, all the access, including today's Know Your Exam series, will be available to you 24/7 until the exam day. And how are we going to make this exam in one go? And what are the tips and tricks to the exam? Okay, and as you know, since 30th of March 2021, Mrcpi membership exam has gained UK recognition. So what does that mean to all of you out there? It simply means that the international medical graduate like yourself will have if you have the full membership exam, you will gain a GMC registration, which is another opportunity and door to work in NHS. Okay, so this is a golden opportunity to everyone. So again, like I say, it is an internationally recognized qualification in Obs and Gynae. So it is now you can use this as one of the door to the GMC registration. So when is the exam, or what's the schedule looking like, or the calendar? So the exam is yet to be confirmed on the exact date. So it will happen in February 2023, and the location is in Saudi Arabia, and we are still yet to hope to hear from the college about the opening date. And the exam fee is 1,420 euros. So in terms of cancellation policy courses, I know a lot of us are facing these challenges since the outbreak of the pandemic. So either we cannot get exam sitting, or either we are not in time having visa being processed. So don't worry, the college is quite accommodative in terms of the cancellations or giving refund, or if you would like to defer your exam to the next sitting. So again, if there's a personal reason for deferring the exam before the closing date for the examination, so there will be a full refund minus 10% administration fee, and after the closing date, of course, unfortunately, according to the college policy, it is not eligible for any refund.
Yeah, I would like to add in, friends, that just in this recent exam, few of the students who could not get visa for Ireland, few of them, they could not appear in November 2022 for Oman because of the traveling regions and the restrictions. College has sent them the emails to shift them because they had paid the fee, they had registered for the November 2022 exam. They have been shifted to the Riyadh diet that is in Saudi Arabia for February. So that was really a very good gesture, I would say, and I would like to appreciate. Even 3 days before, a student was waiting for traveling to Ireland and she was shifted in the February diet. So you people don't have to worry. Once you book your exam and then there is any problem, please stay in touch with college because they are quite flexible and they help students till their, these limitations and these dates, provided the date, of course, is not crossed. So you do send an email and you stay in contact with them if there is any sort of a restriction and if you feel that you won't be able to make up because of your traveling reasons.
I think we do take it positively and just be patient and let the college do the administrative part. And I believe everyone who get deferred will get the priority for the next diet exam sitting. Okay, welcome, Dr. Atia. So again, if it's for personal reason, like I said, just be patient, just write to the college and the college will respond to you almost immediately and give the valid reasons and produce whatever documentation that's needed. So what is the passing rate? Again, so from the 2021 diet, so the Irish trainee first attempt has 100% passing. And for overall, for the Irish trainee, it's 100% passing again. So Irish graduate first attempt 100%, Irish graduate all attempt 100%. And if you look at the international medical graduate first attempt is around 78%. And overall for Irish, international medical graduate is 74%, and overall globally, all candidates is 78%. What that means is that comparatively to MRCOG3 and also EBCOG, MRCPI definitely has a higher passing rate, and therefore that is the reason why I'm stressing why are we taking MRCPI, because the passing rate is high. Not that I'm saying that it's an easier exam, but definitely you still have to put a lot of hard work into it. But the passing is relatively higher compared to your other health membership exam.
Here, I would like to just have a little discussion with Jinu and Tehmina. Students, whenever they have to opt for the venue, they always ask that, ma'am, shall we take in Ireland? Or Tehmina is also having these questions in the study group, that shall we take in Oman? So I always say my point of view for this is that, see, it's about preparation. And whatever suits you for traveling, that is something. In February diet, we don't have an option at all because the exam is only being conducted in Kingdom of Saudi Arabia. But what do you guys think? Jin, what is your take on this? And Tehmina, what do you think about selecting a venue?
Yeah, Dr. Tamina, would you like to go first? Or?
Okay, thank you. Very nice introduction for Mrcpi. So just traveling is a little bit difficult because visa processing sometimes, but who are try to give exam part 3 early as early possible, they can try for Ireland, because if you choose Ireland, they can give you you can attend first, but in another nowadays it is less, I think so. Before it is very difficult to get if you pass this March and get to give exam in May, it will be difficult not get seat. But if you choose Ireland, you can get the first attempt.
What do you say, Jane?
In terms of yeah, of course, in terms of where the venue is, it doesn't really matter, because again, the exam is set in blueprint and also is a standard setting basically. So again, the venue doesn't really matter. Again, like what Dr. Tamina said, whatever opportunity come first, you should go for that attempt, and you should try to attempt your part 2 clinical OSCE immediately after you're passing your your written exam, basically.
Absolutely, friends. Here, I would like to add in that Mrcpi Part 2 Obs and Gynae Clinical, as early as you take after passing your written exam, the better it is. I would like to tell you that no matter in the first go, if you get a rejection and they say that you don't have the seat for this exam, please do not stop studying. It is our experience for the last 3 diets that even 10 days, even 10 days and 7 days before exam, students have received email. Why? Because like 5-7 days, if a student says that, yes, because of the visa, I've paid the fee, but shift me to the next diet, immediately the other students in the study group, they tell us that they've received an email. So we can correlate. Whenever they get a seat, they send to the upcoming students if somebody can book. So if you're prepared, you can take the chance even in last 7-10 days. This is my suggestion and my advice to all the upcoming aspirants, that in the first go, if you get the email that you don't have the seat, please do not close your books. Keep on studying, because there is a chance. And you can make an email that if you get any chance by means of like any student not able to take exam, I'm happy to take. One of my students, she had her husband in Ireland and she had to get shifted. She made an email, and just in 15 days, whenever they got the slot, they did consider. What I mean to say is that in your personal circumstances, do not consider that if you're appearing in Ireland, you won't be passing, and if you're appearing in Oman, you won't be passing. Take your traveling ease into mind and your comfort, that what suits you in terms of traveling, because at the end of the day, preparation matters. And as Chin is saying, that it is a fixed format. It is the answers, they are standardized, and it's going to be the same, may that be Ireland. But yes, your administrative things, they do matter. So consider them and then choose the best venue for you. And if you get an email that you're not appearing in the upcoming exam, keep on studying, stay in touch, because there is a chance that another 7 to 10 days you'll get another email. When the last date for the students of registration, it's there, they do send the emails again. All right, Jim. Yes, please.
Yeah, thank you.
Mhm.
So again, of course, the prerequisite of sitting the Part 2 OSCE or clinical is having to pass the MRCPI Part 2 written exam. So you have all gone through the return to be able to come to this stage. So the OSCE component and the clinical exam has real patients or I should say simulated actor in the station itself. So OSCE component, which Dr. Sidra Ali will be taking you through the 5 different sessions with 7 active stations. And of course, each station, you will be given 10 minutes to complete your task. And depending on what the task is, you will go accordingly to that. So the clinical examination, clinical exam day, or the clinical exam component, which myself and Dr. Tamina will be taking you through this, is the one long clinical case, which is 25 minutes. So you can either get an obstetric case or a gynecology case. Believe me, most candidates would have sailed through the OSCE 10-minute station without any problem. But the pitfall of that is usually in the long case, basically. So in summary, the OSCE has 2 obstetric stations, 2 gynae stations, 1 communication station, 1 simulation station, and 1 labor ward management station, which you all will be seeing the same pattern recognition again in the recall sessions and all your discussion. So your clinical component has a simulated clinical case, so which means to say there is an actress or actor seated inside the station with a pair of examiner. You will be provided model equipment. It's either a pelvic model or an obstetric pregnant abdomen model. So like I said, you can get either obstetric or gynecology case, and you're expected to interact with the role player in the first 5 to 10 minutes, and the remaining time will be spent with the pair of examiner that's present in the station. Okay. I'd just like to add on to that, since the COVID outbreak, there hasn't been any a hospital visit or real patient as such. So again, like I told the last 3 batches, I think this worked to your advantage because in the past, I think they do give you a neurological examination and a cardiovascular examination, which no longer holds true in the current diet. Okay, so how to apply for this exam again? So like I said, the exam date or the opening has not been announced yet. So we will wait for this to be open on your portal website, which is rcpi.ie. So if you see this button here in green, so that's where you will click in order for you to be linked into the next page. So if you click on the green button, so that will bring you to this outline of your page basically, and that will consist of Mrcpi Part 2 ONG Clinical. So you'll be able to continue from here, this button, and then that will automatically generate a payment link, okay, where you put in your card details. Again, for I'm not sure if there's any Irish candidate or doctors or international medical graduate working in Ireland for this sitting. So if you are working in Ireland, so 400 euros will be reimbursed from the payment itself. So you're paying 1,420. So if you go to the NER portal of HSE, you will be able to make a new application to your human resource management, and 400 euros will be reimbursed to you if you do not get through the exam. But if, of course, hopefully all of you will get through this exam. So if you get through the exam, you will get a full reimbursement of 1,420 euros. Okay. So again, this is what the TSS that I'm mentioning, which is a training support scheme, where you have a funding of 1,500 euro per year maximum. So how to pass this exam in one go? So it is important to prepare the Mrcpi exam and not to underestimate how long it takes to get ready to sit for your first exam. Having understanding of how each exam is formatted and how questions are constructed will help you to prepare and develop a good answering strategy. Okay, so like I always say, know your exam and play the game. Okay, so when you are preparing your study plan, so make sure that you have a very structured format, have a study partner, be active in the chat group. So this will all help you gearing towards passing the exam in one go. So the course outline is actually drawn from this curriculum. So this is the basic specialty training curricula, and that has been revised earlier this year in 2022. If you want to have a look at what is the expected knowledge minimal standard that is expected out of the BSD trainee. So for the Irish training on the Irish setting, this exam is outlined at BST Year 3 standard. So means to say they have finished their senior house officer year, or they have 2 years of basic obstetric and gynecology training, and they are at their junior registrar level. So they do need this exam, the full Mrcpi membership, for them to be able to proceed to Year 1 HST, which is the highest specialty training. Okay, so again, like I say, keep calm and play the game. Know the game, know the rules, and then you will sail through without any issues. So these are the past topics that you will actually see, and you will be going through as well as you go along in the next about 6 to 8 weeks, I should say. Yeah. So these are the topics that has come, and it is the recurrent theme that has come in the exam. And in the last exam, if I remember correct, it's just in the recent sitting, I think almost 80 to 90% are recalls. Am I right in saying that, Dr. Sidrali? Yeah.
Absolutely. I would just like to add in that this exam, there were 2 days in Oman, and Friday and Saturday, and the Saturday was in Ireland as well. So 1 day in Ireland and 2 days in Oman, absolutely all would repeat. When we were doing with the November batch, they knew all the questions. Here, I would like to add in C, because it's a discussion with an examiner, or for that matter, the long case, you lead the long case, you discuss with an examiner that what is going to be the question asked to you, and you give an answer. So basically, if somebody tells you that I was asked this question, it's not that you know the answer of this question. For instance, if you take menorrhagia, we expect all of you to know the complete Irish guideline on this. It's not that 1 or 2 questions which were asked last time. So basically, you need to skill and you need to have a good grip over that topic. For instance, just a few days back, like I think 3-4 days back, me and Tamina, we were discussing FGM was being discussed as an exam question in the study group February 2023 batch. So we were discussing that the legal implications are important. However, they were not asked to a few of the students. Few of the students, they did say that, yes, they all asked about the law in the female genital mutilation. So what I expect is that, see, we have to give our 100%. It's not that we prepare that topic scanty. When we know that this topic is important, when we know that this topic is being asked, so let's have from A to Z the entire topic. We skill the topic, we basically have a good grip over that topic, then we are safe. So as Chin is saying, that we need to know the game and we need to play the game with full confidence. We should not leave any stone unturned. These topics are minimum topics which we have given you. We are starting in the study group. I expect you all to know the details of that topic. Dr. Atia, Inas, Muna, Ahmed, all those in the study group. I want that when it's shoulder dystocia, the entire Green Top guideline should be known to you. May that be the algorithm, may that be the answers about the steps, the definition, because when it's on the examiner, the discussion can go in either of the ways, but you should be confident that, yes, you know endometrial hyperplasia with atypia, without atypia, you know the Green Top guideline, whatever they ask, you don't have a problem in this. So these questions are very, very important, and they have been mentioned in a sequence with you guys. We have posted that in the study group. You know what you have to do daily. The benefit of that is that daily when you put in, Tehmina gives the feedback, you guys know that these are the pitfalls we need to add on. And that separate study group which you guys have, where all the stations are being solved, just before exam, you people will scan those topics. Let me tell and guide the February students that November students were so confident, they had gone through it 3 times. Like they knew that these questions are coming up and they used to discuss in the study group all the details. Yes, Chin. All right, Chin. Would you like to take forward? Yes, the question.
Sorry,
Yes,
I was
no
mute.
worries.
Yeah.
No worries, no worries.
So this, thank you very much. So this is the Mrcpi Osce course structure by the RFA. So what you can see that this course has been prepared meticulously and carefully, and all the selected topics are the hot topics that has been a recurrent theme over the last 3 batches that we have. So the long case, you will have the privilege of doing 7 long case session with myself and Dr. Tamina. So each session consists of 5 long cases, and you will have the privilege of practicing 35 cases. And with Dr. Sidra Ali, you'll be doing the Osce circuit. She is an expert and pro in this. So she will be doing 5 sessions with you guys, and 7 cases each, so you have a total of 35 cases. Okay, so every session will be recorded and they will be available to you on the same day. Okay, and you will have the privilege to listen back again to all the recordings.
So we
So
are starting with the long case
yeah,
tomorrow, Chin, isn't
yes,
it?
we are starting
Yeah,
with long case
that's
tomorrow.
lovely.
Very
That's lovely.
exciting time.
Oh, yes. All right. Atya, Inas, Moona, everybody ready? Chin is going to do the long cases with you guys tomorrow. Yes. So in the start, a few people fumble in the start. If there is some sort of, nervousness, it's pretty much understandable. Don't worry, Atya, Inas, Moona, Ahmed, if you guys feel that from the start, if we are not coming up with the words, we are thinking about, we have to speak this, but we are not able to say what we want to say. Gradually, you people would feel that the flow is better. So learn the tips to organize yourself in the long case. And from today, because it's a very good opportunity, especially for all those who are living actually in Kingdom of Saudi Arabia, to take this exam in February. And I'm very happy for all of you who are there, and this diet has been open for the very first time. So take this opportunity, give your best, and you would do it. Chin is going to describe few of the stations, two of the stations, just to tell you that how the marking is being done. Yes, Chin.
So this will be how the station will appear in front of you outside the station. So you have 2 minutes to read through the instruction or the question. So again, don't rush through things, just assuming of you would have formulate some question in your head. So because you have read this question somewhere or it looks somewhat similar. So always take that 2 minutes of yours outside the station to read the question and decipher it and digest it and try to break it down into whatever task that's given to you, and see what are you expected out of this question or task, like whether it's either patient safety domain, communication with patient, family, colleagues, and information gathering and applied application of your clinical knowledge. Okay. So this will be sort of a structured discussion with the examiner in the 10 minutes in the station as you go into the station. So Dr. Sidra Ali and the rest of the RFA tutor will be telling you all the buzzword, all the key sentences to use when you go into the station. Okay, so this will be kind of the model, the mark sheet or the model answer from the examiner point of view, but you won't have the privilege of seeing this, but this will be discussed with you in the feedback session after the 10 minutes that you have performed during the course. Okay.
That's what I was talking about a little while ago. When it comes to any of the station of a circuit, you can no pinpoint that this is what I'm going to say, and I'm going to have only this understanding that this is my friend told me that I was asked about the management plan. Whenever it's a discussion, you'll see that basically your answer at times might lead to the next question. This happens specifically in the long case as well, and it can happen in a structured discussion with an examiner as well. So what we expect is that, for example, if preeclampsia is coming, you've got two hypertension guidelines in the Irish curriculum. So what we expect is that all the Irish guidelines are on your tips. And believe me, when you know the Irish guidelines, your around three structured discussions, they're done. So 3 to 4 specifically are coming. The NTD is very important. They give the preeclampsia so many times. They are so fond of the breaking bad news anomalies, like diaphragmatic hernia is coming, the gastroschisis versus omphalocele is coming. We'll give you all set pattern that this is what is the minimum requirement. Of course, we don't have any sort of a limit to the studies and the curriculum, but there are certain things which are must. And those things are our requirement, that you are well versed with that, not once, not twice, but at least thrice before going to the exam. What about the long case?
Yes. So long case, like I said and mentioned earlier, is one of the common reasons why the candidate is not passing the Part 2 clinical OSCE. So there are tips and tricks to this as well, which we will all go through all different angle and all possible question. Again, it's a very short simulate. You will be provided with a very short kind of scenario, a few liners, just as it will appear in front of you. Again, look at what the task and what is expected out of you. History taking in the first 3 to 5 minutes with the simulated candidate, the actress, and then you will have a plastic model just like what it will appear in front of you, or it could be a pregnancy or pregnant abdomen if it's an obstetric station. And like I said to the last 3 batches, generally the model or the mannequin is working towards your advantage because it's probably going to be a normal finding. But again, listen to the examiner, which direction is the exam is going forward. It's either, like for example, the examiner will say, okay, on your bimanual examination a while ago, you found that there is a mass that's palpable or ballotable on the left or the right nexa. What are your possible differential? But your examination earlier on could be just a normal examination. All these small little technical skill like smear taking, bimanual examination, or examining a pregnant abdomen will be some sort of minimal competency that they will be looking for in a year 3 basic specialty training in Ireland. Okay, so again, this is just the examiner question that is supposed to be posed to you, and it depends on what the task is, and you'll be marked accordingly. So this will be the mark sheet that will be used by the examiner that is not available to you, but they will be marking according to the competency of your history taking, okay, and also your clinical examination. Next slide. And next slide. Next slide. Next slide. Next slide as well. And this will be the discussion that we will use during the course. So again, like I said, the role player, it has a very important role in giving you some free, easy mark, whether she felt confident in you, whether you have been giving good explanation to her, and whether she has been listened attentively, whether she felt that you have the empathy, and whether she would like to see you in future consultation. So again, this free, easy mark will differentiate you between failing and passing the overall exam diet. So it is very important for you to be able to express that kind of thoughts and flow during the examination for you to obtain full mark. And it is very easy, okay? So the global rating scale, again, whether it's a clear, fail, borderline pass, which is the discriminatory zone, differentiating you, and this will be the group of students that will determine the pass mark of that exam diet. Unfortunately, there's no certain percentage that we can offer to you and say that, oh, 74 or 75% is the actual passing mark. Okay. So, yeah, I think that's all from me, Dr. Sidra. Back to you.
Thank you so much. Thank you. All right, friends. So the idea to meet today was to understand the concept that what Mrcpi Osce contains. Now, I would give the permission to unmute the students here, Inas,
Yep.
Mariam, Atya. Before starting, because again, I would say that for my KSA students, it's a golden opportunity to take this exam. It's going to be very easy for you guys in terms of making an arrangement and to reach out. And many of you are in the Kingdom of Saudi Arabia, so it's going to be really easy for you guys to appear. Did you guys understand, Inas, that what is the gist of the preparation, how the preparation is going to be taken forward in terms of the outline of the things which you have to cover up? Any questions are there? Me, Jane, Tahmina, we are here to answer your questions and address your concerns, please. Because from tomorrow, the full throttle preparation would be started. Even the ones who are quiet and are passive in the study group, I would definitely like you guys to get active and start studying on full throttle because the time is less. Soon you people will be feeling that, oh, the exam date has just been announced and you're just ready. Mariam? Yes, my dear. Inas, Inas have been active. Yes, I could see that Inas, because she was ready for the previous one as well. But then we decided for the February diet because of being in KSA. Yes. Any questions, please, regarding the preparation, please? Any doubt you guys are having? Anything you people want to ask that this is something? Sophie, yes, my dear, please.
Yes, Dr. Sidra,
Yes, my
yesterday I saw Dr. Shen, he put a long cases, like 5 cases. This is, we will discuss tomorrow, all 5?
Yes, that's right. All 5.
All 5, which mean what you are posting is for the next
Yeah.
Zoom. We'll discuss all 5 tomorrow.
Yes, that's right. So the topics that was provided and in reference to all the Irish guideline, talk article, NICE guidance, and also GTG guideline. So they will be discussed tomorrow, all 5.
Okay,
So,
and the short cases that Dr. Tahmina she's sending, from what I cannot understand, that the schedule, I don't know which guidelines, the Irish or the GT Green Top guidelines, the small one.
We've got a Telegram channel in which all the material that has been compiled together. You go to the search bar of that Telegram, Sufi, and you write, for example, FGM. You'll get the related data which you have to prepare. You don't have to search any data anywhere. If it comes to mitral stenosis, you'll just write mitral stenosis in the search bar of Telegram, and the content which you have to prepare, that will be coming just in front.
Okay, thank you so much. Thank you.
Yes, Tamina would like to add something. Yes, my dearest Tamina.
Yes, about this, I also want to add,
Yes.
during preparation, you are telling, I also put some talk also, new talks are also coming. I know that last time you were very serious and want to learn that time everything, but I advise you just 1 or 2 talks you can study from now.
2022 and back, right?
New talk.
Yeah.
Maybe
The talk,
not more talks you have to, topics you have to read. So few topics are there, just try to read from now. Lastly, you will think I didn't read it that, and maybe come. Really one from every exam, one topics come from the recent talk. So it is my request to everyone. We also do, but we don't know which topics come, that we have no idea about any questions. So we are not discussing all the topics, but if you study from now, it will be benefit for all.
The talk will be in the RFA website.
Yes. So if you open up the RFA website, all till October 2022, all talk articles are available. They're summarized. So at least you're not blank. What Tamina wants to say is, I would like to expand on this, that generally if 1 or 2 new circuit stations, they're coming generally, if you see the last 3-4 exam pattern, they're coming from the recent talk articles. So even in November 2022, the MRCP Part 3 exam, we had an early ovarian aging, which was a recent talk article. So peripartum cardiomyopathy had been a complete station this time in MRCP Part 3. Again, that was a recent talk article. There are testing. So the college generally, if at all, one new question tends to come. So if you have to prioritize yourself, first, have a good grip over the exam questions, exam stations. After that, daily, at least if you do like 1 to 2 talk articles, it hardly takes like 40 minutes to do 1 talk article. You just need to do the tables, the hang of it, like the recommendations, the important points, because there's lots of data like researches, the Cochrane that have been mentioned. So you go to the important points. You make your 10-15 important points. So you'll just be over with that, right? So rather than doing in the last 10 days, what she wants to suggest is, if you start doing it now, so you won't have that pressure, because in the end, students say, ma'am, what if some new station comes? So we are guiding today that if your daily routine does allow you, that would be great, that if you start doing 1 to 2 talk article from today, just open up the website, make your schedule that, okay, this 1 talk article I'm doing today, you can discuss in the study group. We are happy to help you, because the memory is better once you discuss. All right, Sophie, Claire, my dear? Tomorrow, you people would be super clear after meeting Chin about the long case, because again, I would say that in the beginning, if you're making mistakes, if there is a little fumbling, if it's nervousness, believe me, even any presenter who stands on the stage for the first time does have trembling legs, and that's very common. But gradually you guys would get confident. You'll start loving your preparation. You'll start loving the feel of this OSCE preparation. That's different. It's all about your communication and speaking and your flow. And you people would start loving this once you people get a gist of the preparation. You people will start enjoying your journey of preparation and then your exam as well. Inas wants to say something. Yes, my dear.
Hi, everyone.
Hello. Happy to see you here. Thank you very much. How's
Thank you
family? How's
very much.
everything? That's great, my dear. Okay, yes, Inas.
Alhamdulillah, we are all fine.
Thank
Actually,
you very much.
I'm post on call. I just came and I said,
I'm so grateful.
when is the session? So it
Yeah,
was
I
like
did see
after
in the
30
study
minutes.
group.
I was about to collapse because I had a very bad night.
Oh, I'm
So
so sorry.
I would, it's okay. I just wanted to know, because I want to attend live sessions as much as I can.
Yes, that's
So
that's our
do you
suggestion as
have a
well.
fixed time?
I
There is
think
like tomorrow, I'm morning
all of
duty.
us, we are happy to start at AMs. So Chin, what did we decide? I think
Yeah.
8 a.m. What do you say?
If we start
Time?
at 6 a.m. GMT, does that suit most people here? I'm not sure.
Yeah.
What do you feel, Dr.
So
Anas?
actually, definitely it suits them, Meena, it suits me as well. That's not a
Yeah.
problem. What we can do is that Inas will just write, Chin, you can just write a message in the group and we can
Yes,
fix this so that everybody knows that
definitely.
this would be fixed time for the entire
Yes.
OSCE. So they
Yeah,
can
we'll
just
see what
organize
is the
that.
consensus. Yeah.
Yeah, then we
Thank
can
you very much
organize
for
the
that.
timing. Yeah,
Yeah.
thank you very
No
much, Inas.
problem.
Chin is just going to put a message in the study group and we'll take forward from there and we'll decide so that you can organize your duties and rota accordingly.
Mhm.
Okay. All right. Atia is quiet. Mariam is quiet. Mariam, I want to hear from your side. Now I would see that you guys are starting up with full confidence. Yes, whatever daily is being told. Hello, Mariam. How are you?
Alhamdulillah. Assalamu alaikum. How
That's
are
great.
you?
Wa alaikum assalam wa rahmatullah. Yes, I'm very well. Thank you so much, my dear. So, Mariam, did you? I know you joined somewhere in the middle, but please do
Yes.
listen to the record. So
Okay.
you understand the outline of exam, that what are
Yeah, I
you being
just felt
tested for?
yesterday, and I just it was bombed on me that I have to write everything. It was
No,
it was
but even if you don't
difficult.
want to write, you can
Mm.
simply take printouts of your students' attempt, right? And everything is there in the Telegram, but try to speak more. Because again,
Yeah.
as I was saying, Mariam, it's a golden opportunity for all the KSS students because it helps them. It is one of the diet again for the first time. So if you just pass your exam in this go, that will be really great, and that
Yeah,
definitely
I'm
adds on to
definitely
confidence.
here.
Yes,
Inshallah, ta'ala, from tomorrow I will start
that's
because
very good.
inshallah,
That's
I was
wonderful.
just scared with the notes, so I asked you back home.
No, once you start, Mariam, once you start speaking, you'll see that, okay, there's a difference in preparation and, confidence would coming up. Definitely, yes.
Inshallah. Thank you so much. Thank
Inshallah.
you so much.
Thank you so much, Mariam. God bless, my dear. Thank you so much. All right. So these are our lovely students who were with us in Mrcpi Part 2 written, and few new students are joining us as well. For the February diet, of course, we are not expecting Chin, the Irish students, but in the written exam, they all are appearing in March and definitely would be joining up for the May diet because many of them are in the written exam for us, and written exam is also starting for the March next week. So they already are anxious to appear in May. So this February diet would be the Saudi Arabia diet, and all these Gulf students, definitely the Gulf students, that suits them the most, and everybody wants to join for this. So friends, what I would suggest again is don't make it a delay. Don't wait for the dates because they give it very late. Today is the time that you should start up with your preparation. What is your last advice, Tahmina, to your students for this journey, please? Yes, Mariam, you want to say something?
One question I just want to
Yes,
ask:
my dear.
whether they will they give preference to KSA students, or it is something again they will pick anyone from anywhere?
Mariam, what I think at the moment is that the maximum applicants are KSA students. So
Okay.
yeah, so all the students, in fact, we know lots of them from the study group. Many of them, they're preparing for May. They're skipping this diet because it doesn't suit them, of course, going to, this place. But Gulf students, they definitely are there, and they want to have this backlog getting over. So it suits you guys best. You definitely am going to get seats, so don't worry about that. Take it seriously. Yes, you people would be able to appear in this exam.
Yeah.
Inshallah.
And
Inshallah.
thank you so much. Thank you. Yes, Tahmina, please, some last advice for the students before we call it a day. All right.
I just
think
want
she's
to add
also
one
finished.
last
Yes,
thing.
yes,
Because this exam will be in February, so
Yeah.
it won't suit the Irish candidate because it is during the major changeover and the overhaul of the changing of hospital basically around the country. So definitely, and that, again, it doesn't suit the Irish candidate to go to KSA as well for the exam. So, just grab this opportunity as much as you can to prepare for this exam, because you have highly likelihood of getting a seat this time.
Exactly. This is what I wanted to say, that otherwise many of the students who have passed, who couldn't appear in November, they're directly going for the May diet. So you guys are having really a good chance to not only to appear, and of course, because the Irish students are not there, it's something like a diet which is only in Saudi. So your competition is only with your type of students as well, otherwise you people get scared that, oh, it's going to be a high merit, it's going to be a high percentile because the local students are there. So this time you people have to take it. The idea of encouraging you guys is that today, please take a start. Every time you're not going to get this opportunity, because May would be again in Ireland and UAE, again, the traveling, again, the administrative things and those problems you guys would be facing. So take a start today. Ensure that you people understand that you're in the right direction. Anything you people require from our side from today only, put in the messages, put in your queries. Do not hesitate, and ensure that you people are well prepared. I need complete 3 revisions before exam. And I mean it, okay? 3 complete revisions of all the important stations, the long cases before exam. That's the only way that you would be super confident. Yesterday, we enjoyed the Mrcpi Osce results. And students were saying that we were meeting each other before we knew, looking at them, yeah, Chin? Adam was saying, looking at them, we knew that this is RFA student, because the idea was that we rehearsed so many times. And it was a spectacular result. Same as those students, we are expecting the hard work from your side. We would be giving our 100%, but at the end, we do expect you guys to be good in flow, because you are going to speak out there. You are going to impress your examiners. That would only happen if we are confidently starting our preparation and speaking from today. It's not about learning an Irish guideline. It's about standing in front of the mirror and speaking that Irish guideline, okay? So that the confidence, the words, they come out spontaneously. They come out in a good flow. All right, so would I see the change in the study group? Would I see all of you being active in the study group from tomorrow? Yes? No matter you make mistakes in the start, it's always a starting journey is always hard. You people would see that gradually you'll get better. All right? Yes? Thank you. So, Chin, everybody is super ready for tomorrow's long case, and we're going to start with the same enthusiasm. Best of luck from the entire team of RFA tutors. We are starting this journey with this faith that hands in hands like a family, we would end it up in a celebration. Thank you very much to all the friends who have joined us today, and all those who are listening to the record, who were on duties, who couldn't join because of this time, early morning. We would see you guys in the study group, hoping to see all of you successful. Thank you very much, Chin. Thank you, Tahmina. Thank you, RFA backend team. Thank you very much to our lovely students. See you guys with the next New Year exam series. Bye-bye from our side. Take good care. Love you all. Thank you so much.